Thank you to the co-chairs. Thanks for having me. I'm delighted to be here. I'm Sule Kwanga from the transgender network in Fiji called the House of Chameleon. So basically, I'm going to be giving my perspective as a young transgender person in Fiji. Transgender people are highly vulnerable and marginalized throughout the world. Experiences of discrimination are common when seeking to obtain basic human necessities such as employment, housing, and healthcare, as are reports of violence and harassment. It comes as no surprise then, given the association of negative health outcomes with stigma and discrimination, that transgender people like myself experience severe health disparities across a number of outcomes, including HIV, and transgender youths are often left out of HIV prevention education. Much of the HIV prevention education available to youth happens within schools, but because transgender youth often drop out due to stigma, harassment, and violence, they do not receive the critical information. Many existing programs that purport to serve LGBT youth do not have the capacity to properly address the needs of transgender youth. Transgender youth need access to substance abuse treatment, housing, hormone therapy, employment and legal services, and comprehensive sexuality education that includes youth, tailored health and HIV prevention messages, services, and programming to increase knowledge, build effective skills, and create opportunities for health promotion and sustaining health lives. Because many transgender people, youth are simply struggling to survive. Did I just press something? Sorry.
It's okay.
HIV is often not their highest priority. For example, recent studies have reported that a number of trans youth have attempted suicide. Creating services and programs that are comprehensive and reflective of trans youth specific health and wellness needs to be preferable to simple HIV prevention. Transgender women are diverse in terms of sexual orientation and partner with people of all genders. Very rarely do the partners of transgender people have access to support and HIV prevention information that is specifically relevant to us. It is important that transgender people are able to include their partners in the HIV prevention strategies and support networks. While it is important to support all partners of all genders, the greatest current risk for transgender people the great current risk for transgender people is their male sexual partners. Transgender people are in dire need of access to comprehensive, culturally sensitive, and affordable healthcare. Transgender-specific clinics that offer a range of diverse services are needed, in addition to the integration of transgender competent care in mainstream health service organizations. Many transgender people purchase hormones on the street, underground markets, or on the internet without a prescription, and their use can be unsafe when not monitored by a medical professional. The provision of hormone therapy is neither costly nor difficult, and transgender people's quality of life is markedly improved through appropriate hormone use. Receiving hormones is often an incentive for addressing HIV among transgender women and health promotion and prevention for other diseases. Primary care providers for transgender people need to enhance the HIV expertise and assess for risk and review prevention strategies with patients. Transgender people who know they are living with HIV often do not have a regular medical provider or do not see their provider on a regular basis due to concerns about confidentiality, lack of transgender sensitivity in services, and past negative experiences with HIV treatment providers. Transgender women often experience fear. Transgender women often express concerns about receiving HIV care somewhere other than where transgender women will be because they fear it will result in the loss of confidentiality. These concerns can be alleviated by providing HIV care in the context of hormone therapy. In addition, HIV-positive transgender people need to be educated on the importance of adherence. There is a strong need for education, training, communication among service providers, educating organizations that are providing HIV prevention services to other key populations, that is MSM, about how to serve transgender clients who may seek services there. Transgender people need to be able to seek all types of healthcare without fear of discrimination based on gender identity or legal status. To be effective in serving transgender clients and patients like myself, providers must be trained and updated on new HIV prevention trends to tailor their services in practice, better identify transgender individuals and their health needs, share educational information and best practices with other providers, maintain a transgender-friendly schedule, and build local capacity of and establish better linkages to mental health professionals. Sorry, is my time up? No? Okay, I'm just a bit confused.
1 minute.
Furthermore, to some of the recommendations that I'll be sharing with you today, hiring and training of transgender women in research and programming is necessary for programs to succeed. There is a high unemployment rate due to employment discrimination and lack of job training and educational opportunities. Staff turnover creates a barrier to forming long-term relationships with transgender patient and leads to disruptions in services and impedes trust. Therefore, it is critical to support staff development and adequately compensate employees to medical benefits that are inclusive of transgender healthcare. In addition, creating paid internships and fellowships focused on transgender health are essential for building capacity in the field and engaging young transgender professionals early in their career. People who know they are HIV positive are more likely to seek medical care and change their behavior. More timely diagnosis of HIV can improve treatment and care, prolong survival, and reduce the spread of HIV. HIV is most often transmitted by people who are unaware of their status. Programs need to be reaching those who do not know yet that they are HIV positive, connecting those who test positive to care, ensuring continued access to care, and re-emphasizing prevention among those who test positive. Testing is an educational opportunity for everyone, regardless of HIV status. HIV testing needs to be normalized among transgender people and their partners, and barriers to testing must be addressed. HIV testing is not shared among transgender women who engage in sex work because accusation of HIV positive status can be used as a weapon against sex workers who are in competition with one another to secure dates or paying sex partners. Loss of confidentiality is a major fear among transgender female sex workers due to the threat of loss of income and means of survival. Testing sites need to take this into consideration when planning their services for transgender women. There's also a need, finally, for a development of evidence-based HIV prevention interventions that are transgender-specific. Despite high prevalence rates, public health interventions research has produced no culturally specific evidence-based HIV prevention interventions for transgender women. Given the complex sexual risk factors present among transgender women, HIV prevention programs developed for other populations that are simply adapted to include new language will not ultimately address the cultural context in which risk behaviors occur and which protective factors develop. There are a lack of resources for conducting needs assessments, especially with youth and trans men, evaluating existing programs and providing competent and ongoing technical assistance or consultations for organizations providing services to transgender individuals. Future needs assessment might examine non-HIV specific activities and resources that may contribute to reducing risk behavior. This needs assessment could then be utilized to inform culturally specific interventions for transgender people. Oh, time's up. Thank you.
Hi. I don't know good evening, good morning, or good afternoon because I'm like lost here. Well, I'm Gautam from India. Thanks for inviting me here. I'm a bit nervous. I'll take you through my personal story. I'm not having any presentation or anything. First, like as a young person, what initiative I have taken in my country is first is like I make a group I'm a founder member of one group called Yarya. Yarya is a youth group in Mumbai which works for LGBT people, for their rights, for their legal issues. If there is any person who is facing stigma, discrimination, they can approach to the Yarya team, and we look forward. Second initiative I have taken, that my one Facebook group where is like people around the world, almost like 300, more than 300 people from LGBT community, and the group called Harmless Hugs. I kept the name Harmless Hugs so that everyone can join, bisexual, transgender, gay, lesbian, straight peoples. They can just hug each other and share their stories. And as an adolescent, I was not that much lucky when I was going through my adolescent age. Like, I'm living with HIV since when I was 18-year-old. And when I was 14, 15, and 16, there was no one to teach me that what is HIV and AIDS, what is sex. But somehow I get involved in all these things, and with whom I was interacting, those people were also not telling me about anything. They were just doing it. So I came to know about my status when I was 18-year-old. So for adolescent, I have taken one initiative in my country. That is, I have my own organization also called SOUL, Society of Universe Lovers. I know I'm giving us such a nice name, I guess. So in that, I have taken that initiative. We started with the 5 kids who are like stays in slums, who go to the road and collect the bottles, plastics and all, who never been to the schools. They are below 18s. They never seen the schools, how it looks like. So we started with the 5 kids, and now we have almost 45 kids. We are providing them free education, basic knowledge, so that next year we can approach to the government school and give them, take them to the proper school, like from first class to, like recently we got one kid's admission in 4th standard in March. When we talk about like adolescent and sexuality and all, I think law should be in place, and law plays a very major role in each and every initiative. In my country, homosexuality is not legal. That was legal in 2009, but I don't know what happened to the Supreme Court, and they decriminalized that homosexuality again. I think the age of consent is the biggest challenge for the adolescent who, like, when I was 15, I was knowing what I am doing, but I don't wanted to share all these things with my parents because I was not comfortable with that. But for me, if there is a doctor, counselor, or anyone stranger, I can just go to them and I can share each and everything because they are a stranger to me and they don't know anything about me or my parents. So I was like, every adolescent can go and talk to the strangers, but they are not able to talk to the parents because they knows that parents will take them wrong, or they'll take them to the psychiatrist, some other things, because they also feel that homosexuality is bad. Like sex education is also not a good subject. Like in India, people says that recently our health minister says that sex education is fine in India, but we are not against of it, but we are against of the vulgarity. I don't know. I just said yesterday also, like, if sex is vulgar, then I don't know this Indian population is coming from. What is vulgar in sex? Like mental health issues, when we talk about mental, there are lots of issues which we are just, if we start, then we can just discuss about it. I'm just talking about the issues which I faced personally, and that's how I just took that initiative to come out to my country and take adolescent and young people forward to work for them something different. Like when we talk about mental health issues, there were some issues in my family, and I taken to my mom to a psychiatrist in government hospital, and I told him that psychiatrist that I'm gay, and his first reaction was, "Have you done your test? How can you say that you are gay?" And I was like, what kind of test you want me to do? So, and I was totally confused because, and I told him that thing that being a psychiatrist, I never expect that you are going to ask me this question. You should talk to my mom or you should talk to my parents for this thing that homosexuality is not a bad thing, rather than taking me to the test. So these type of issues are there. Like, sorry, I just written some key points. I'm almost done. I'm not taking so much time. In India, we have adolescent education program also, which is not implemented to the each and every state. We just started in few states, but we have left states like Uttar Pradesh, which is like huge state, and there is lots of people who wants to know, like there are lots of adolescents, but we are not covering them, and government is not even taking any action against regarding that. Like there's no education, there's nothing. Like people are just, they don't feel like if in India, like first we produce so many kids in one family, and if I'm the older person, then I have to look after my 5 siblings because my parents are working. So that's how we work. We don't go to the school. We don't think that school is so good. So I'm kind of lost, I guess. But I just wanted to say last thing that as a young person, each and everyone, like I'm looking this session, this is like almost half of the auditorium is full, and I would love to clap for all of you because you all are here and most of them are young. And as a young person, I just wanted to give this message to each and every of you. As a young person, we should take some responsibility to take like each and every person forward. That's it. Thanks.